In this lesson, we'll tackle the different question types that you might encounter during your actual examination. Let's see them one by one. Here are the expected types of questions that you will encounter on your actual examination. It might be a multiple choice option, fill in the blank, the multiple response. This is also known as the select all that apply or the SATA. This is the most famous of all the question types. The ordered response, where you arrange them based on your responses, hotspot, drag and drop, audio item, and graphic item. The NCSBN provides specific directions for you to follow with all of these question types to guide you in your process of testing. Be sure to read these directions as they appear on the computer screen during your actual examination. Now, let us discuss these different question types one by one. The first is the multiple choice. Many of the questions that you will be asked to answer will be in the multiple choice format. These questions provide you with the data about a client situation and provide you with 4 options or answers. You need to select only one. For the multiple response question, this is also known as the select all that apply or SATA. You will be asked here to select or check all of the options, such as nursing interventions that relate to the information in the question. In this question type, there may be 2 or more correct answers available. No partial credit is given for correct selections. You need to do exactly as the question asks, which will be to select all of the options that will apply. The next question type is fill in the blank. In here, you may be asked to perform a medication calculation, determination of intravenous flow rate, or even calculate an intake or output record on a client. You will need to type only a number, which is your answer, in the answer box provided. If the question requires rounding the number, this needs to be performed at the end of your calculation. In a hotspot question, you as a user really need to indicate the answer by clicking a specific area of an image or a hotspot. A hotspot refers to a predefined range of pixel coordinates within an image that when clicked indicates a correct answer. For the drag and drop or ordered response item, this type of questions, you will be asked to use the computer mouse to drag and drop your nursing actions in order of priority. Information will be presented in a question, and based on the data, you need to determine what you will do first, second, third, and so forth. The unordered options will be located in boxes on the right side of the screen, and you need to move all options in order of priority to ordered response boxes on the left side of the screen. Some of my colleagues mentioned this type of question in their own examination. For audio questions, you will be required to listen to a sound to answer the question itself. These questions will prompt you to use the headset provided and to click on the sound icon. You will be able to click on the volume button to adjust the volume to your comfort level, and you will be able to listen to the sound as many times as necessary. Content examples include, but are not limited to, various lung sounds, heart sounds, or bowel sounds. I did not encounter this type of question during my actual examination. For the graphic items, the option selections will be pictures rather than text. Each option will be preceded by a circle, and you will need to use the computer mouse to click in the circle that represents your answer choice. As you can see, question types may vary from each candidate to another, but the most common is the multiple choice questions with single answer. Having knowledge of this is essential for your preparation for your examination.